Yeah.
All right, let's jump into some segments since I was running behind. Apologies, guys. Kylie Jenner. You like Kylie Jenner?
Yeah, of course.
Yeah, everyone likes Kylie Jenner. So she broke the internet, I think it was yesterday or the day before. So Kylie Jenner, the 27-year-old TV star and social media icon, opened up about her breast implant, breast augmentation surgery, and went into some detail. And of course, the internet just goes bonkers. And now there's all these articles, where plastic surgeons are breaking down like what she had. And so obviously we're going to do that. But there's something really interesting, and this segment may be different than some of the other ones you might see out there, because I noticed something very strange in what she posted.
What?
And we're going to talk about it. So there's a British YouTuber named Rachel Leary who did a public call out about Kylie Jenner's boob job specifics, and very awesomely, Kylie Jenner responded in a comment. So throw a comment up there, Trey. Yeah, so she went into 445 cc's, moderate profile, half under the muscle, silicone, Garth Fisher, who's a surgeon. Hope this helps. And so, yeah, if you get on the internet now, there's like a bazillion posts about this. And so, yeah, I thought I'd break it down because I am a specialist in breast augmentation and breast revision surgery, so I can actually talk all about it. All right, and I do think it's cool that she did that. I mean, because a lot of people are very secretive and they don't want to talk about it, but she actually went into detail, which I think is, more information out there, the better, right?
Yeah.
Yeah, totally. Okay, so 445 cc's. Okay, so that's pretty big for an implant, but not crazy at all. In my practice, the average implants I use are like 250 to 400, but I do bigger ones. I mean, we've talked about this a million times on the show. There are downsides to going really big, and so when patients want to go really big, I try to reel them in a little bit, because one of the things I do a lot of is revision implant surgery, and I'll tell you, there's a lot of women who get big implants, and then 5 years down the road, they're coming back to either take them out completely or downsize. And so, if you make a smart decision up front, then less chance you have to come back surgery.
Makes sense.
Yeah, so 445, that's roughly going to make it go up about 2.25, 2.5 cup size, more or less. I mean, I like to say the estimate about 200 cc's is like a cup size roughly. So anyway, pretty good size implant. All right, now here comes the weird part. All right, moderate profile. Now, if that's accurate, that's weird, and let me tell you why. So profile basically means for a given breast implant volume, how wide is it? So if you have, say, a 400 cc implant that's high profile, it's going to be pretty narrow. Am I pointing at the right camera? Yeah. It's going to be pretty narrow and have a lot of volume. And then if you have like a moderate plus profile, it's going to be a little wider, same volume, a little wider, but a little bit flatter. Moderate profile is very flat. There's low profile, which no one ever uses, moderate plus, high profile, and then there's ultra high profile. And I would say 90% of the surgeries I do are high profile. Occasionally I'll use ultra high profile, and occasionally I'll use moderate plus. And picking the profile purely is based on the patient's dimensions and how much implant you're going to use.
So whenever you say profile, it's like,
think about like a profile.
The width around, like, so.
Yeah, kind of. So the profile just means like, what's the shape of it? Is it more like this? Is it more like that? Or is it more like a pancake?
But is the pancake is going on top of your
breast, yeah,
chest,
correct.
Like that?
Yes.
It's not going like that?
Correct, yes, absolutely.
Okay.
Yeah, absolutely. Yeah, it's flat on your chest.
So maybe she wanted more of that like under boob
really
situation.
So that's a good
like
question.
Having that like side cleavage and all of that. Because they wear a lot of low cut dresses, and they like that. Yeah. That curve.
So I think there's two explanations to this. One is the explanation that you just said. She wanted to have a very wide breast.
Yeah.
And in order to get a very wide breast, you would use a wider breast implant. Now, most people would not want that. There's definitely downsides to that. The other, which I think is probably the more likely explanation, I don't think this was her initial augmentation. I think she's had breast surgery prior. And so what I found many times when I do revision breast surgery is that either through the surgeon technique not being great, or maybe it being a huge implant, the pocket gets bigger than you want it to be. And when you're placing implants, you do not want to put an implant that's, say, this big in a pocket that's that big. Because then you get this almost like ping pong ball in a sock look. you want the implant to fit the pocket. And so what may have happened is this may have been a revision surgery, and she may have said something like, hey, my implants fall into my armpits because the pocket's too big. And you can do a surgery to decrease the pocket, but it kind of sucks. It's a pretty big surgery. I do them pretty commonly because I get a lot of revision work, meaning people have problems and they come to me. But one solution is just to use a wider implant. You know, it's a little bit flatter, so you don't get the oomph out, but it'll look better because it fits the pocket. And so I think probably, I mean, I don't know obviously why they chose this. It's just weird. I mean, if it was moderate plus, I'd be like, maybe she's just a moderate plus kind of gal, but she's pretty narrow. You know, normally if I'm using moderate plus, it's because a patient has a really wide chest. Yeah. You know, and again, you want the implant to fit the pocket, and so the pocket's going to be bigger on somebody who's got a very broad chest. Well, she's not broad chest at all. Like, she's skinny, she's narrow. And so that is definitely weird if it is truly moderate. And maybe it's moderate plus, and she just said moderate because she's not that familiar. But that was a weird thing. I saw it, I was like, whoa, that's not normal at all. Which, I mean, you know, does it really matter?
Can't call her up.
Yeah, I'm gonna call her. Hey, come on the show. Tell us about your implants. So I thought that was really unusual. It definitely is interesting that was the implant that they chose. That guy, Garth Fisher, I mean, that guy's a legit dude. I think he's out in LA or Beverly Hills. I've heard his name a time or two. Yeah. And he is a board certified plastic surgeon. So he obviously, you know, knows what he's doing. So I don't think he just threw the wrong thing in there at all. But yeah, that was interesting. And throw up the picture tray of her, because she does have really wide breasts. I mean, you know, for her frame, her breasts are almost like smashed together in the center. It's like they're almost like encroaching on another, and then her breast sticks out, you know, to the side. And for me, honestly, I mean, obviously she can do whatever she wants. Like, to me, like, for her frame, like, her breasts are like, they're a little on the large side. Yeah. She doesn't look proportionate to me. Obviously, that's not her natural.
I'm like, have you seen her butt? It matches her butt.
Yeah, and maybe she was shooting for that. I mean, almost in that picture, it looks like the right one's sitting a little high, but it's probably just the way that she's sitting.
Yeah, I think she's just sitting like that.
But anyway, I did think that the profile choice was notable and unusual. And I'm going to come back to why we're going to talk about it. And then she said half under the muscle. Okay, so that's just standard submuscular, more likely a biplanar dissection. Like, that's the standard these days. You know, we've talked about that in the past. Like, there is this kind of new push to put implants on top of the muscle. In fact, I was just like going back and forth with a plastic surgeon on Instagram about this yesterday. I don't really believe in that. Like, the reason that some surgeons will push the above the muscle subglandular, subfascial placement is they say, one, the breast won't move, you know, there's no animation deformity. My kind of counter to that is if the augmentation is done correctly, there should be minimal to no animation deformity, even if you put it below the muscle. And the other is they'll talk about the recovery. Well, the recovery is easy no matter what. But there are research papers out there that show that overall complication rates are lower if they're submuscular. Plus, just having more tissue over the implants always a good plan. Yeah. You know, and the other thing too is not everyone's a candidate to put above the muscle, because if you have really small breasts, you definitely don't want the implant like right up to the skin. Yeah.
So like, what if you were asked to do implants for like a bodybuilder girl?
I mean,
do they have to have theirs above the muscle because their muscles are
no,
like
they don't
huge.
have to. Absolutely not. No, they don't.
But would that affect their?
I mean, if somebody was like a truly like bodybuilder, I mean, yeah, you might consider. The problem with the bodybuilders, they're going to have very low body fat and they're going to have not a lot of breast tissue, and they're probably not going to be candidates to put above the muscle anyway. Okay. Because there's a thing called a pinch test where you determine how much breast tissue there is. And there has to be enough volume of breast tissue to safely cover the implant. Bodybuilders generally are very fit. Yeah. And I've done implants on people who work out like crazy and never had a problem. Yeah. And I do mine I do the biplanar submuscular. She mentioned silicone. Okay, that's also standard. It would have been interesting if she knew a little bit more about the silicone, because now you have like the soft gels and then you have the more cohesive gels, and those all.
I'm sure she got the most expensive one.
They're all the same. You know what's interesting is the cost is like all the same.
Like, nice.
Whether you get a very tiny soft gel or the largest cohesive gel, same cost. At least in the brand that I use. And then the surgeon name, which we already talked about, yeah. So like things to know about this, right? Because now what's happening is everybody's like, oh, I want 445, you know, moderate profile silicone implants so I can look like her. Well, it doesn't work like that. You know, what an implant looks like on one person and what it looks like on another could be absolutely different.
Yeah.
Right? Because it just depends on what you have. I mean, if you have two identical twins who are identical body weight, then yeah, maybe you're going to get the same look. But outside of that, no. I mean, you want the implant that's going to be best for you. And so kind of the take home for this is that, you know, when you're picking an implant, you just have to really have a discussion with your surgeon and make sure that they are willing to have that lengthy discussion with you about what does it mean if you do this? What does it mean if you do that? Meaning, you know, there's a lot of different variables when you're picking an implant, you know, size, profile, the gel, the shape. And you want to get the one that's right for you and not be like, oh, my friend had this and that's what I want.
For sure.
Yeah. I mean, if you say my friend has this result and you show me a picture, I'm like, okay, we can recreate that.
Yeah, that's a better way, I think.
Yeah, definitely. And I like when people bring in pictures. I mean, it just helps you kind of like nail down exactly what's going to look best. So, but yeah, pretty interesting stuff. Of course, obviously, when I saw it, I was like, oh, we're going to have to talk about Kylie.
You need to be reminded that you need to talk about Kris Jenner's face, her mom.
Oh, okay. Text me. I remember we talked about it, and I've already forgotten.
She has like really good, like had some work done on her face,
okay.
and she looks so
Does she really?
good. Yeah. The before and after pictures, like she's always had work done on her face.
I'll take a look at it.
But,
I'll take a look. The only thing I'd say about Kylie is, you know, with the size that she has, I mean, I think she's definitely at risk for, she may end up getting a revision surgery, you know, in the next 10 years. Which again, then it goes into how long do the implants last? Well, these new implants could last 20, 30 years, right? So, you know, by going that big, I mean, she's definitely putting herself at risk that, hey, you know, I might have to have another surgery sooner rather than later.
Yeah.
All right, let's recap this one, Trey. Today we're talking about Kylie Jenner broke the internet yesterday when she went into a lot of detail about her breast augmentation surgery because somebody asked her on social media and she answered. And she said that she had 445 cc moderate profile, half under the muscle, silicone gel implants put in by Dr. Fisher. Was it Fisher? Yeah, Garth Fisher. And everyone was talking about this and what does it mean? Well, I'll give you the breakdown. 445 is a good size implant. It's pretty big, but not crazy. What was really unusual was the fact that she said moderate profile, because that is a very flat implant. And I will tell you, the overwhelming majority of women when get augmentations get a higher profile implant because that gives the look that they want. And it's kind of different that she got a moderate profile, and we were talking about how it's either because she either wants to have a very wide breast to get that side boob, or probably more likely this was a revision surgery and she needed that implant to fit the pocket that she already had. That's something that comes up when you do a lot of revision surgery. But outside that, she has a nice result. They are kind of big for her. I was mentioning that because they are so large that she very well may have to have revision surgery in the kind of sooner time frame versus the latter, but I guess we'll see. So cool stuff.
Very cool.